recording.
This is Michael Smook for YouTube Talks. Today is July 22nd, 2017, and it's a Saturday. Today we're on the road in Kingston, New York. The topic of today's conversation is I dream things that never were and say, why not? The topic of today's conversation is talking about economic and social justice. Before I outline what this YouTube talk is about, let me explain the title. I belong to two meetup groups, and we meet every 4 to 6 weeks, and I talk about this forum that I have on YouTube and also my Google Plus essays. And my fellow club members, they're very polite, but they say, Michael, what's going on in Washington, it's simply not possible. What's going on? And I smile and politely say, enough is enough. Look, you see things that are and say, why? I dream things that never were and say, why not? And then I say, look, the future belongs to the dreamers. As long as we're rational, realistic, and resilient, eventually we'll get what we want. So that stops them for a second. Do I change their minds? Probably not, but I give them pause for thought. Now let's talking about economic and social justice. Let me give you an outline and then we'll move forward together. The first chapter, chapter 1, is entitled About My Father. My father was in the U.S. Coast Guard during World War II, and he witnessed something on board ship, and an injustice was committed, and belatedly he was able to testify and participate in social justice. Chapter 2 will talk about my thoughts about social justice and what we're doing in the 5 boroughs of the city of New York to administer social justice to residents in medically underserved and poor communities. Chapter 3 we'll talk about what is economic justice and what can we do in the United States now to energize the economy, to strengthen the middle class and expand it and reach out to low-income folks. Now with that said, and then I'll summarize. And now let's go to the introduction, chapter 1. 1945, my father was 23 years old. He was a petty officer in the U.S. Coast Guard. He was deployed in the North Pacific, and his ship was a destroyer escort, and they arrived in South Alaska. The crew had liberty. When they came back, a fight broke out. 2 of the sailors got into a fight. One of them was African American. As my father was quoted in a newspaper articles many years after this fight, he said his African American fellow sailor and shipmate was being savagely beaten, and he feared for this fellow's life. This fellow managed to get to his footlocker, and he was able to gain access to a knife. He stabbed the other sailor, and the sailor died. And what happened in quick order was this sailor, the survivor, was court-martialed, sent to prison, and after prison, he was given a dishonorable discharge. One could say what happened could be a form of racism. Now, what happened was 52 years go by. My father is semi-retired as a businessman and an attorney. He receives a phone call from Hofstra University School of Law, and they said, could you come in and talk about this incident? And my father said, sure. So he explained what happened, and it was considered a formal testimony, and that testimony, a deposition, was put together with other materials, and it was sent to the governor of Alaska, Tony Knowles. He's still alive today. This was 20 years ago. He was governor of Alaska, and he read through the materials, and he decided that this man was merely engaged in self-defense, and this was a miscarriage of justice, and he signed a document and awarded a pardon to this fellow. This sailor, 52 years later, he wasn't well. He was unable to make the trip from New York to Alaska, but I read quotes in the paper, and the sailor was overjoyed that this happened. So you can say what the governor did, and with my father's assistant and the lawyers at Hofstra University and the law students, was a measure of social justice was awarded to somebody who was deserving and who had to suffer over half a century of an injustice. Now, the part of the story that I don't know the answer to is, did Hofstra University ever appeal to the Department of Defense, which has supervision for the Coast Guard in times of war? If this didn't happen, in a better world, this sailor should have had his record expunged and the prison sentence and the dishonorable discharge, and he should receive monetary compensation. Perhaps I'll look into that and we'll find out the answer to that. But suffice to say, this is what social justice is about, and this is how government sometimes could come through and make out for a historic wrong and create a remedial effect, which is something that's very important. Now, since I spoke about my father and how he was able to participate involved belatedly in a righteous act, let's talk about my thoughts about social justice. Instead of giving you a 1 or 2 line textbook definition, let me talk a little bit about social justice. The United States is 241 years old, and the Constitution provides all Americans, along with the amendments subsequent to the Constitution, ending slavery and all. The Constitution provides all Americans due process and other benefits under the Constitution. And so, the thing is that when you look upon justice, just about so many groups have had justice denied, and they've had to fight for long periods of time to receive justice under the Constitution. And when I think about injustice assigned to groups over long periods of time, I think of people of color, Native Americans, women, people based upon their religious beliefs, their political affiliation, their so many other groups. And if I've missed out on you, it's you're in my thoughts and my heart, but time prevents me from going into these details. But suffice to say, the United States, with our Constitution and amendments, is the supreme law of the land. And we've made mistakes, and people have to fight hard for their rights. But we're a work in progress. In terms of social justice, we could look at programs that are a huge part of the federal budget, which give social justice to all Americans. If you look at insurance, Medicaid, Medicare, Child Health Plus, subsidies to the Affordable Care Act, that's insurance. If you look at retirement, Social Security insurance, and you look at people who are hungry, you look at food stamps. All of these programs combined are about half of the federal budget. So these programs are a measure of social justice, which all Americans are entitled, depending upon your age and or your economic status. But all Americans, regardless of your race, ethnicity, and other factors, all Americans are eligible to this. Now, I want to talk about specifically, we don't think upon this as a liberal era and an era of an expansion of progressive rights, but let me just give you one example in the city of New York. What we're doing to award a measure of social justice, it's the public health approach. It's really the people who are behind that are senior management in municipal public health. The New York City Department of Health is the largest municipal public health agency in the country. And so what the the commissioner and the deputy commissioner for the Center of Health Equity have done, they've done many fine things, but in particular, they've looked at the map of New York and the poorest communities in the city of New York, which are medically underserved, where there are a great many of people who could have better health. There are preventable deaths that could be eliminated. There's disease that could greatly be reduced. And senior management in the health department has looked at these factors, and what they've done is they've put their money where their ideas are. They've looked at the poorest communities. They've looked at, thinking about Tremont in the Bronx, and Harlem in Manhattan, and Brownsville in Brooklyn. And what they've done is they've renovated facilities. They call them neighborhood action centers. They've increased the staffing, and what they're doing is they're using the good offices of the health department to help these people. The staff goes out and knocks on doors, old-fashioned way. They also encourage people to come for lectures and other services. They also reach out to people through flyers, through internet media. But what happens is, when people come in, what happens is if people they don't have insurance under Medicaid, if they're hungry and they need to apply for food stamps, staff works with them to make sure that these measures of social justice are assigned to these people. The next step is, if people are not, they don't have a family doctor. So the health department reaches out to sister agencies, municipal hospitals and clinics, nonprofit healthcare institutions that render the same services. The health department uses its good offices, so everyone who comes into the neighborhood action centers, everyone who comes in, they and their families will have a family doctor. And then, in addition to primary care, if somebody has an acute problem or a chronic problem, they could be seen by a specialist or admitted to a hospital. Also, between the facilities I've just mentioned and the health department, what's taken care of is preventive measures, vaccinations, testing for HIV and STDs, and if their people are positive, they're referred to specialists for ongoing care. With cocktails today, people can live much longer. Also, with the health department, since they're rolling back preventable deaths and sickness, there are a wide variety of illnesses that affect the community. But if people are living longer and healthier lives, what the health department is also doing is it's using its good offices to bring in farmers markets so people can eat healthy. And they're also working with supermarkets and bodegas to come in. So what isn't covered under food stamps, the city of New York and the health department are paying the difference. So people are eating healthier in poor, medically underserved communities, and the sickness rates and the preventable deaths rates are going down. I've watched the commissioner on most of her YouTube videos and the deputy commissioner for health equity, and they said something remarkable in their videos, something that really was a little different. They said, look, if these communities remain poor, we cannot have a jobs program, but we still think we can improve the numbers so people will live longer, healthier, and because they're eating nutritious, in that way, happier lives. So I thought that was remarkable. But it also led me to the next step in this YouTube talk, which is Chapter 3. Let's talk about health equity. My thinking about economic equity, economic justice, really, that's Chapter 3. My thinking really goes back a year. During the presidential race, the debates, a very close election, and now 6 months into the new president, I'm thinking about economic justice. Bear with me for just a second, but in terms of economic justice, I think about since the end of World War II, when our